Hi everyone, welcome to this presentation. I want to discuss here the results of an extended patient survey from a Dutch Painful Bladder Syndrome Interstitial Cystitis patient association to identify patient-reported healthcare problems. These are my disclosures. The aims of this study was really to do an extended patient survey which has been conducted in 2019 by the Dutch Painful Bladder Syndrome / Interstitial Cystitis Association, and it had a couple of aims. One was to focus better on the real patient needs, also to obtain data to improve awareness amongst clinicians and to achieve more patient-centered clinical management. And as a third target, we really wanted to improve the association's public lobbying function to really be more aware of what our patients are experiencing. As for study design, our materials and methods, well, again, in 2019, we used SurveyMonkey to construct this patient survey, and we distributed these surveys amongst the members of the patient associations. All the topics in this survey were defined by a stakeholder group of patients, clinical experts, and independent methodology experts. And the questions were mainly focused on epidemiology, diagnosis, quality of life issues, and therapy satisfaction. And this abstract really focuses on quality of life determinants, such as sleep, working, school, sexuality, partner relationships, social contacts, mobility, and housing and accommodation issues. We used statistical analysis with a Pearson's correlation test to look at determinants and correlations between those determinants. 234 patients or people responded. Of these respondents, 91% had a diagnosis of painful bladder syndrome, and these were confirmed by urologists in 92% of cases. And the results for coping were really that the impact of painful bladder syndrome on a patient's life was rated as, well, in 46% it was rated as very severe, and in 33% it was rated as severe, so quite overwhelming. 10% really felt that the disease was overwhelming them, and really 24 patients additionally found it difficult to cope with the disease, and an additional 52% were really just coping or dealing with the disease. So you can see the impact it is on quality of life as shared with many or a far majority of patients. Coping was also correlated to all domains of quality of life significantly, and also to the duration of the disease, but not to age. And we really found that all these coping issues and quality of life determinants issues were really if you just had the disease, but also if you had the disease for very long or years on end. So it's a real chronic problem. The quality of life on subdomains was rated on a 0 to 10 scale, and it showed in decreasing order that the most determinants that were mostly impacting their quality of life were actually, as one was sleeping problems or sleeping disorders, and continuing down until work, school, sexuality, mobility, social contacts, and partners and relationships. We were actually quite surprised by how high sleeping problems were associated also with bladder pain syndrome. That was something that we as clinicians were not, well, we know there were sleeping problems, but not that were like the dominant factor on quality of life impairment in the majority. So as a concluding message, I think patient surveys are a good tool for patient associations and physicians to identify key priorities as defined by patients themselves. I think quality of life and coping problems are persistent regarding of the duration of having painful bladder syndrome. And I think these results should trigger healthcare providers to focus on problems that are determinants for their quality of life. And as last, I would really like to recommend that sexuality problems should be addressed in all age groups, since it is seen in our survey that it affects all age groups.